Fall is here, you guys. It is my all-time favorite season. I love everything about it, and I love everything that tastes like pumpkin. I'm a sucker when it comes to this kind of stuff. And so I couldn't go the season without making a fall spiced butter. I call it Body Workers Brew. I've been toiling and boiling in the kitchen, and I love what I've come up with, and I challenge you to smell it and not smile. Okay, so when I was in massage school, I was taught a very specific way to treat trigger points, and since then, I'm not sure what I'm doing with my butter here. There it is. There it is. And since then, I've learned that there's a bunch of different ways that people treat trigger points and a bunch of different theories about what a trigger point is. And so I wanted to address some of that today and give you what my perspective is after 17 years of being in the field and feeling like I'm taking combinations of many different schools of thought, plus kind of applying what I feel I have learned on my own. A trigger point is essentially a small part of a muscle or a small section of a muscle that has knotted itself up. When the entire muscle knots up, that's what we know as a cramp, but a trigger point is when part of that muscle knots up and creates a lot of pain, creates a big painful response. Sometimes there's only one or two, sometimes there's a whole bunch of them. That's when we have what we call a syndrome. But trigger points live in a muscle belly and can live in almost any muscle in your body. So just a minute ago, I was doing what looked like a pretty fast effleurage, and my point of that was to warm up the connective tissue around the muscle fiber so that the connective tissue liquefies and I'm able to sink directly into the muscle. Once I've done that, I want to start to sink in deeper and feel for those trigger points, and this is when communication becomes incredibly important. I've obviously chosen to demo on the upper back, which is where most clients complain about feeling trigger point pain, and I could talk about all the different things that this feels like when it shows up for your client. That is a whole huge conversation. But the main thing I want to talk about with this area of the body is that there are so many muscles involved in a trigger point syndrome here that identifying where the trigger point is can be really tricky, and figuring out how to access the depth of those trigger point or trigger points can be quite difficult. I believe that trigger point therapy is all about communication, and right here what I'm doing is sliding very slowly along the medial border of the scapula, and if you can see with my left finger there, I was sinking in and talking to my client about where she was feeling the source of the pain. As I roll over a trigger point, she is going to be the main source of information for me. I can talk to her about what I feel, but if it's not corresponding with what she feels, then the work is not going to be as effective. So I want to start to communicate to her about her ability to tell me when I'm on something that feels poignant, or when I'm on something that's radiating, or when I'm on essentially that deep trigger point. I commonly find them really close to the medial border of the scapula, and what I'm doing here, once she and I have determined together that we have found something, I'm kind of hitting it from different angles, and I'm asking her which angle is most powerful. So you can be on a trigger point, but if you're not hitting that right angle, it just is not going to get to the source of it. And you want to make sure that she's feeling like that is that final point, that is the exact point. And that's when you want to start to actually do your work. I've walked around to the other side of the table because I feel like my body mechanics are much stronger when I'm working into this particular groove of the medial border. I don't feel like I'm pulling towards me as much. I feel like I'm able to use my body weight and sink in. So after I've repositioned myself, I want to recheck in with my client and make sure I remember the spot well and make sure I have hit that angle again. That is the crux of her pain. Now for the really boring part. So this is going to look like I've paused the video, but what I'm doing here once I've found that spot is I am sinking in and I'm finding out exactly the edge of her pressure. I like to call it a comfortable discomfort that really feels like I'm getting down to the bottom of that trigger point, and I just hold it. I hold it for a really long time, up to 1 or 2 minutes, and I'm talking to her while I'm holding it. I'm giving her all sorts of audio cues that can help her release her scapula away from her rib cage, that allow her to envision open spaces between those muscle fibers and breath coming in and helping those muscle fibers elongate and lengthen and help her to really let go on a deeper level that hasn't been accessed before. I've just checked in with her arm to make sure that she's really letting go and to remind her to let go. And I'm still holding. I'm asking her to breathe. And I'm starting to talk about the idea of moving past pain as opposed to rejecting pain. What happens with trigger point therapy often is that the client will feel the pain and want to kind of guard up against it. And half of the battle here is going to be your client's ability to be able to maneuver through the pain as opposed to fighting it and rejecting it. Some trigger points are pretty simple, and that's almost all it takes. But for deeper trigger points or more involved trigger points, I want to consciously make nice before I move on and continue to sink in. I do not think that inflicting pain upon inflicting pain upon inflicting pain does any good. I definitely believe very wholeheartedly in the idea that flushing things out and allowing the body to adjust and absorb what it feels in its new state can be unbelievably beneficial. I often think about trigger points like an itch on my back, and when somebody's scratching it, I start to all of a sudden feel like my whole back itches. And trigger points can often feel that same way, not because they're phantom, but because there are related trigger points that start to kind of reveal themselves when you start to release one. I've brought my client's arm off to the side, and what that does is pull the scapula away from the spine, and I'm just starting to expose muscles that are deep and buried underneath the scapula when it sits flat on the back. When I do this, I'm starting to communicate with the muscles that are all attached to the scapula and how they work together and how they've created this dysfunction. And as I sink down into this trigger point that's a little bit more lateral than the one I was on before, I'm using my finger here, using my other hand to help with pressure, and I'm just doing the same thing I did previously, holding, communicating, asking my client to breathe, and letting that grip of this trigger point of this irritated muscle start to release. At this point, I'm going to move my client's arm off the table at a 180-degree angle, and obviously that's going to pull the scapula really far away from the spine. The serratus anterior is buried underneath the scapula and really does attach to the medial border, but it also attaches to the ribs. So when the scapula is pulled down like this, you're getting elements of the serratus anterior that have not been accessed before. And when you find trigger points buried this deep, this can often be the source of pain that is radiating out to the shoulder, down to the arm, sometimes all the way up to the front of the pecs, up to the side of the neck, and possibly sometimes all the way down into the low back and into the hip as well. Buried trigger points like this can go unnoticed and can go untreated and cause a downward spiral effect that can just create more pain, and because nobody's detected the source of it, there seems to be no answer. So when we find these trigger points, really treating them with knowledge and with care is going to change your client's whole experience with massage therapy. I know it looks like I've paused the video again, and I think this is a good opportunity to talk about the fact that when you're working on a client who's not familiar with trigger points, it can sometimes feel like you've paused the video on them too. They might be thinking in their own head, what is this person doing? Why are they not doing anything? And this is your opportunity to educate the client. This is your opportunity to talk about what's going on, why the radiating pain is going down certain areas, and the relationship of the muscles that are at work here, and how all of this stuff can be released if we allow it to be released, as opposed to hanging on and never changing our patterns. I don't believe that trigger point therapy is some kind of magical cure. I think it can feel that way sometimes, but ultimately what we're doing is helping a gripping muscle to release. And when we're done doing that, when this muscle has finally let go, it's really important to make the connection of everything that's involved with what this muscle does. So with my client right here, I'm just pulling down her arm. I'm noticing very clearly there's a difference between how her scapula laid on her back before and how it's a little more raised off of her ribs now. And give all of those muscles through the shoulder, the back, the neck, all the way down the arm, a little bit of kudos for all of that hard work. If you've watched any of my videos before, you've seen me do this move a couple times. I love it so much. I think it's so incredibly effective and feels so good to the client. But I particularly love it for this kind of post-digging work. Because once you've dug into that area of the rhomboids, the traps, the serratus, and all of those muscles that are deep in the upper back, you can't really stretch it out when your client is prone. So flip them onto their back, pull their arm across their chest, pull that scapula away, and just give it some love. Show the scapula how it can move now and allow these muscles to reconnect and reacquaint themselves with each other in this new healthy relationship that they're gonna have that's gonna feel so good. There's so much more to say when it comes to trigger point therapy, and I would love to hear what you guys have to say. So any comments that you have about the work that I have done here or the work that you do in your practice, please leave them in the comments below. And just like always, there's a like button and there's a subscribe button, so click on that and don't forget to be awesome.